Hi, I'm Dr. Annette Hulse. I'm an osteopath in private practice in the San Francisco Bay Area, Los Altos, California. I'm also an adjunct professor of OMM at Toro, California, and a past president of the Osteopathic Cranial Academy. I'd like to welcome you to my video series, Think Like an Osteopath. I hear all the time in my teaching, whether it's medical students and residents rotating in my office or colleagues several years into practice that I'm teaching in a CME course. I've never heard that before. Or why didn't they teach us this in medical school? This channel is my answers to those questions. I want to start with exactly that topic. What does it mean to think like an osteopath? This talk is a version of a lecture I gave at the AAO, American Academy of Osteopathy Convocation a few years ago. In it, I'm going to start by reviewing the basic principles of osteopathic medicine, the 4 tenets we use. The body is a unified whole. It has an innate ability to heal and regulate itself. Structure and function are reciprocally interrelated, and rational treatment takes those first 3 principles into account. I'm going to take each one and take a deep dive into it, rather than just rattling it off from memory, to explore what that really means. I want to start with a story. This is Dave Marks. He's a professor emeritus at MIT in civil engineering. He was formerly the head of the Center for Climate Change and Sustainability and the director of the Lab for Energy and the Environment. But for purposes of this story, his claim to fame is that he was my undergraduate advisor. So one day, a group of us were talking to him, and we were complaining about our curriculum, as students are wont to do. He said, "Look, you guys, it is a waste of your time, and," he said, "more importantly of mine, for you to spend time memorizing things you can look up in a book. My job is to teach you how to think, because your job when you leave here is going to be to solve problems that have never been solved before. There is no answer in the back of the book to look up." This is something that has stuck with me my entire life. That's why I wanted to tell this story. It's been my guidepost for my entire professional career. All the things I did before medicine and now as a practicing osteopath. I'm sure all the medical students right now are aghast because this is, of course, what you spend all of your time doing, memorizing things. But when you get out into practice, you will find that there are lots and lots of patients for whom there is no answer in the back of the book. We see them every day in our practices. The vague, unclear symptoms, the chronic pain, the syndromes, people who are not well, but for whom there has not been a good diagnosis established. And for people for whom, even though they may fit a classic diagnostic criteria, the treatments that you are learning don't work for them. So that's what I want to talk about here. How do we learn to think like an osteopath and solve those problems that have never been solved before? And this is what I learned as an engineering student at MIT. When you have an unknown problem, for which there are no answers in the back of the book, you always go back to first principles. In this case, those first principles are the tenets of osteopathic medicine. I want to unpack them a little bit, though, and explore what they really mean when we delve into them, what the implications of them are. Give you some examples of how to think beyond the things that you've memorized and solve those problems for your patients that no one else has been able to solve. We review these tenets. We memorize them. We can rattle them off the top of our heads. But although they seem simplistic at a superficial level, the fact that they're fundamental means that when you dig down into them, the implications give you a lot of, well, if not answers, then certainly guideposts. So let's take us aside for a moment to talk about what is health. It's a term we use a lot, but what does it mean? Does it mean the absence of disease? The absence of pathology? Maybe it's the absence of a diagnosis. If you don't quite meet criteria for disease process, maybe 3 out of the 4 points, does that mean you're well? If you have a lab value that's not quite abnormal, does that mean it's normal? Is everything fine? Or what if you're not quite at the threshold for treatment yet? A lot of times in medicine, we use the words "you're fine" to really mean you're not sick. But does that really mean you're healthy? So when I talk to patients, I often use this concept of health as a continuum. At one end of the scale, blue on the left of this slide, is 100% perfectly healthy, whatever that means. The other end on the right in red is, one step out of the grave. When we look at this continuum, the things we study in medical school are really focused on that red end, those illnesses, people who are truly sick and unwell. And this is where allopathic medicine shines. Now, for people in that red area, I'm rarely going to be their first line of treatment. But even there, one step out of the grave, osteopathic manipulation can be supportive. It can give a little extra help. So, for example, I will often tell my patients, if you're going to have surgery, see me beforehand. Let's get your body as well as it can be going in, and then call me when you're home. I will come to a visit so that we can help you recover better. What I see in my practice, and I think this is true for a lot of people in osteopathy, and actually in a lot of outpatient settings in general, is people that are in the middle of this continuum, that yellow area. All of those syndromes like ME/CFS and dysautonomias and fibromyalgia that we saw a few minutes ago, for which there are no answers in the back of the book. These patients often end up in my office after they've tried 4 or 6 or 8 different doctors looking for an answer and not finding one. Or people who may not be, quote, ill, but who are also not well and they want to feel better. And I see a lot of people at that blue end of the spectrum too. I live and work in Silicon Valley. I have a lot of type A personalities whose goal is to really maximize their health. I have weekend athletes, marathoners, triathletes. And a lot of these people want to be able to do the most with what they've got, particularly as they age. So I tell my patients, wherever you are on this continuum, my job is to help move you to the left. So as osteopaths, we can play a role anywhere, any of these patients, anywhere on this continuum, helping them move somewhere towards the left. So let's go back to our fundamental principles and explore them as we apply them in this framework. The first tenet is the body is a unified whole, and the person is a unit of mind, body, and spirit. Now, I got to tell you, when I have students in my office, and I get a lot of them rotating through, we always talk about these principles, and for the last several years, almost all of them had said something to the effect of, oh yeah, the mind, body, spirit one. Now, it's absolutely true that mind, body, and spirit is an important element of this, and I'm going to talk about it in a few minutes. But I find this answer a little disturbing because the principle is much, much bigger than that. We can talk about the mind, body, spirit as the osteopathic equivalent of allopathic medicine's biopsychosocial model. But in osteopathy, it actually encompasses a lot more. The body is a unified whole. It is one organism. All of it's connected. We're not a Lego set. We're not a bunch of systems that have been plugged together. When a new person is created, we grow from the inside out, not the outside in. All of those systems are interconnected from the very beginning. Now, it's true that the body is really, really complicated, and none of us can know everything about it. So it's convenient to break down into pieces and systems in order to learn them, and then further to develop expertise in them. But too often in medicine, those areas of expertise turn into silos, and people build mental fences around the areas that they're an expert in and forget the rest of the body. So no matter what you do as a physician, you always want to come back to this fundamental concept that the body is a unified whole. It's an organism that exists as one thing, not plugged together pieces. Don't get stuck in your silos. And that's exactly where a lot of my patients in that yellow zone fall, is between silos. So nobody can figure out how to help them. As an example, gastroenterology is not separate from neurology. There are actually more neurons in the enteric nervous system than there are in the spinal cord. The circulatory system serves everywhere. The nervous system goes everywhere and communicates both directions, afferent and efferent. And what about the endocrine system? Cells throughout the entire body are affected by hormonal signaling. And lots of different kinds of cells affected back. For example, you probably do not think about bones and muscles as endocrine organs, but they are. Bones have classically been viewed as this inert structure, a mineral matrix, necessary to help hold the body together. They contribute to maintaining calcium homeostasis because of the large calcium stores in the bone, and they house the bone marrow for production of blood cells. But the bone isn't just a structural scaffolding. It's also a regulator of a number of metabolic processes, aside from mineral metabolism. Not surprisingly, bones contribute to calcium and phosphate balance, where they work with the kidney, the parathyroid, and the gut. But they also contribute to glucose metabolism and insulin sensitivity through osteocalcin. Osteocalcin is secreted by the bones. It acts on the pancreas to stimulate insulin secretion. It acts on the muscles to stimulate insulin sensitivity. And oddly enough, osteocalcin is also a factor in regulating hormones, specifically testosterone production in the lighting cells of the testes. I don't know why, but if you want to learn more about it, a lot of this research is being done by Dr. Gerard Crescenti at Columbia, so you can go look up his research and find out more about it. Muscles, meanwhile, produce what are called myokines, cytokines and peptides that have autocrine, paracrine, and endocrine effects. Myokines affect muscles, that's not surprising, but also fat cells, the liver, the pancreas, the heart, the immune system, and the central nervous system, because myokines can cross the blood-brain barrier. They help regulate learning, motor activity, protect against neuronal injury, and also regulate mood. Sometimes they're called hope molecules. So here's an example where we've heard of exercise as a treatment for depression, and now you know why. Exercise actually stimulates production of myokines, this hormone, which can help regulate mood. Another way we can think about connectivity in the body is the continuity of the connective tissue. When I was in medical school, we learned this as fascia. You'll hear a lot about fascia in osteopathy, but I want to give you a slightly different view of it here, the interstitium. In medical school, we were taught that connective tissue was just the space between the important things in the body, the bones, the muscles, the organs, and its job was to hold that stuff in place, like packing material. Now, much of that is because of the way we fixate tissue in cadavers. It collapses that structure in the connective tissue, and it actually removes all the fluid, which turned out to be a really important component. So in 2018, the interstitium was recognized actually as its own organ. And here's the reference for that paper. What they found was nothing like what we learned in medical school, at least if you went to medical school before 2018. They described the interstitium as containing a highway of moving fluid. Now, one of the co-principal investigators on this paper was interviewed on Science Friday on NPR. And what I love is that he recognized what we do, because he said, quote, "Now we have anatomy for this thing that the osteopaths have been talking about physiologically for years." And that connectedness has since been verified by additional studies. For example, using tracer molecules to trace how that fluid connects and transports through the entire body. So it's important in the functioning of all of the organs. I studied civil engineering. As I said earlier, I studied civil engineering at MIT as an undergraduate. I actually also have a graduate degree in engineering. And I will tell you, as somebody who did way too many problem sets in fluid dynamics, even if the tissues aren't completely connected at a molecular level, molecules that can move all the way in between, they're definitely connected at a hydraulic level. It's sort of the way hydraulic brakes work in your car, where that pressure is distributed as long as the system is flexible. So when we have lesions, somatic dysfunctions, we lose the ability to effectively distribute those mechanical fluid forces. That's what we feel as restriction. And I think it's what we feel as the primary respiratory mechanism throughout the whole body. It's a combination of the actual connectiveness of the fluids through that highway and the hydraulic connectedness of the entire system. So that really the fluids of the bodies are continuous even when they're broken into compartments. Another lens for thinking about this continuity and wholeness is embryology as a unit of function. In allopathic medicine, we really study embryology to figure out what goes wrong. But think about it. The embryo starts as one cell, which divides to 2, to 4, to 8, and so on. At some point, it starts to differentiate into different cell types, the endoderm, the mesoderm, and the ectoderm. which then further differentiate into different organs and parts of the body. We really don't know why that happens or how. We've identified places where things can go wrong, but not what the underlying driving process is. What it does give us, though, is another framework for thinking about how these things are interconnected, that continuing connectedness between structures that derive from the same underlying tissues that we can notice and find and help encourage. Now, it's not a perfect analogy, but I think of it sort of like a game trail in the forest. There's a pattern there. Now, in a forest, if you go up to a bird's eye view at 10,000 feet, you're not going to see it. That's what I would call analogous to gross anatomy. The game trail looks exactly like the rest of the forest. And if you go down to a microscopic view and analyze the specific components of the forest floor, the small plants, the cells, the minerals, etc., there's also nothing different. That's like microscopic anatomy. And yet there's this clear, subtle difference somehow, some sort of pattern, maybe a residual of what's not there. And this can happen in the body too. I think those embryologic forces that we witness are sort of like that. Something we can learn to recognize and find and add a lens through which we look at the continuity of the body. Now let's come back to that concept of mind, body, spirit. Of course, it's such a common statement, it's a cliche. But it's important to highlight that the mind and the body are not really separate things. The mind has a physiologic representation in both the biochemistry and the bioelectrical activity of the brain. So let's take the sympathetic nervous system. When we think about something like stress, the sympathetic nervous system, but also stress hormones, the adrenal glands, are both part of that response. So we're back to that continuity. The nervous system and the endocrine system are not separate. They're both part and parcel of what the stress response goes through and how it affects all the cells of the body. So in thinking about this, I really like the book, Why Zebras Don't Get Ulcers by Robert Sapolsky. He's a professor at Stanford Medical School and a primatologist, also a phenomenal speaker if you ever get a chance to hear him. This book's a little older, but it's really helpful for thinking about the relationship between stress and health. So Dr. Sapolsky studied monkeys. Most primates live in social systems with an alpha male and then a bunch of beta males. And those males are always fighting. They're fighting for position, for resources, for food, for access to females. The beta males get picked on by the alpha male, as well as fighting each other for where they sit in the hierarchy. So they're often in a heightened state of stress. And what he found is that these beta males had substantially higher rates of chronic stress-related diseases, hypertension, hyperlipidemia, even diabetes, compared to the alpha males. Now, you could hypothesize that the males who become the alpha males got there because they were the healthiest to start with. So they did an experiment. They took the alpha male out of each of several groups of monkeys and put all these former alphas together in one new group to see what happened. And in fact, those previous alpha males, most of whom are now the beta males in this new group, went on to develop higher rates of hypertension and hyperlipidemia and diabetes. It was the stress of living in that hierarchical system, not something innate about their biology, that drove that chronic disease. So let's think about the physiology of the stress response. I often describe it to patients this way. What does your body need to do when you have to run away from a tiger? When you have to run from a tiger, when you are in fight or flight, you have to mobilize energy to your muscles. You increase your cardiovascular tone, increase the heart rate and the blood pressure to get that energy out. You sharpen your cognitive facilities, dilate your eyes so that you can see better. What you don't need to do when you have to run away from a tiger is digest your lunch right now. You don't need to take any energy at that moment to put into tissue repair or growth or reproduction. Those are all functions that can wait. And the difference between a human being and a zebra is this. When the zebra is safe back in the herd after being chased by a tiger or a lion, its sympathetic tone goes back to its normal or its baseline. Human beings, on the other hand, worry. We remember and revisit the things that stressed us out. And we anticipate the ones that might be coming down the pike. In another experiment, giving electric shocks to rats. Some rats got randomly shocked, no matter what. It was just for whatever reason. Other rats got shocked but had some level of predictability. For example, every fifth time they went to eat. Now, the stress response was actually higher in the rats that had no control or predictability about when they got shocked. And it turned out it was also higher when they did not have social support or an outlet for their frustration, when they got pissed that they got shocked. So again, there were higher rates of chronic disease that showed up in these rats that had a lack of control, a lack of predictability, a lack of social support, and a lack of an outlet for their frustration. When we're chronically in this state of heightened sympathetic tone, trying to mobilize energy, that can impact insulin resistance and fat storage. Increased cardiovascular tone causes arterial damage and high blood pressure. Disrupted immune function can show up as an autoimmune disease. Suppressed digestion, IBS. Suppressed reproduction, infertility. All of these chronic diseases show up with greater intensity or frequency because of that heightened sympathetic tone. So that's our first principle. The body is a unified whole. By really embracing everything that encompasses, it gives us a place to start thinking about things for which there are no clear answers. Let's go on to the second principle. The body has innate self-healing and self-regulating capability. We use this all the time. It's fundamental in medicine. Everything we do is about enabling and supporting that self-healing capability. If it were not true, we would never do surgery. Or we'd all look around looking like Frankenstein's monster if we did. Now, one thing I learned from a mentor that has always stuck with me, although the body has self-healing and self-regulating capability, sometimes it needs a little help. And it's our job as physicians to give that help by removing, killing, or suppressing dysfunction, or on the other hand, by supporting health and growth, to give the body a fighting chance for its self-healing function to really take over. In surgery, it's not just the skin that has to heal, it's things like bypass grafts, or the anastomosis and colectomy. A broken bone, well, the orthopedist might set it, may even put in screws or plates to hold the pieces together, but the body itself is what heals to get that bone to regenerate. Even in infectious diseases, most antibiotics are not bactericidal. They're bacteriostatic. Penicillin, doxycycline, Bactrim, none of those kill bacteria. What they do is interfere with bacterial replication so that your body's immune system has a chance to regroup and fight off the infection itself. And now we come back to that chronic state of stress that we talked about and how that increases the risk of disease, both because of having the body put too much effort into energy mobilization, that's the insulin resistance, fat storage, high blood pressure, but also by diverting resources and energy away from things like long-term growth and tissue repair and healing, a drain on the body's self-healing capability. I think it's really important to understand this when we talk about chronic disease and lifestyle factors. In medicine, we often talk about lifestyle factors, diet and exercise. But what I want you to take away from this is that sympathetic tone is actually a much bigger deal than that, particularly in patient populations with job insecurity and food insecurity and housing insecurity. The risks that come from that is not something they have control over. What we can do, though, is we can treat them. We can help reduce their sympathetic tone with osteopathic manipulation. We start by listening. We touch them. We show up and be present. Directly treating their sympathetics with osteopathic manipulation can be a lot more effective than saying, you need to change the way you eat. It's nice if people can change their lifestyle, but often they're not in a position to change the things that are really creating the chronic stress. So when I hear non-compliant patient, I want us to pause, because sometimes what they need isn't a lecture on eating kale and giving up soda pop. And when we treat somatic dysfunction, the core of osteopathic medicine, what we're doing is helping that tissue repair function work better, improving the flow of blood and oxygen and nutrients into the cells that need to repair or heal or function better, improving the removal of waste products from them through the veins, through the lymph, through the interstitial fluid. And we come back to that stress response. As we saw, it can suppress tissue repair. So treating it, reducing sympathetic tone in our patients, also supports the self-healing capability. Which brings us directly to our third principle, which shows this in action. The third tenet in osteopathic medicine is that structure and function are reciprocally interrelated. This is why we do osteopathic manipulation. It's the implementation of how we work to enhance the body's self-healing capability. I think it's pretty obvious how this principle applies in the neuromusculoskeletal system, treating things like patellar tendonitis, frozen shoulder, TMJ dysfunction, even post-concussion syndrome. This tenet is at the foundation of everything we do with osteopathic manipulation. By treating the structure, we help the function. Just like that self-healing capability, we don't heal people. We give the structure and therefore the function enough help that the self-healing can take over. Keeping that humility in mind is really helpful at whatever point you are in your medical career. What we're doing is helping a body that is far too complex for us to fully understand. As I like to tell my patients, God is way smarter than I am. So we've all heard the phrase form follows function. It's true in the natural world as much as it is in the design world. This idea that form follows function actually starts in the very beginning, back to the embryo. As the embryo grows, the fluid in that growing blastocyst sets up a circulation pattern. It circulates from left to right. And the stagnation of the fluid in the middle eventually coalesces into a solid and becomes the septum of the heart. Now, if by some chance that flow sets up right to left instead of left to right, the heart develops, but it develops in a situs inversus, reversed. So the function comes first, and then the structure forms around it. Since the very beginning, osteopaths have studied anatomy and embryology in exquisite detail to see what it tells us. Not just about the anatomy itself, but about the function and the physiology and what we can do to help the body improve on that function. Now, I'll be the first to tell you, I don't treat gout or depression or glaucoma per se. What I treat are the dysmatics dysfunctions that can underlie the symptoms and the pathophysiology that we have then labeled or diagnosed as disease. But because of these first two principles, the unified wholeness of the body and the self-healing capability of the body, when we help the structure, we help the function, and therefore we often help treat complaints that are less obvious at first glance than musculoskeletal complaints. So gout, autoimmune disease, anxiety, insomnia, GERD, glaucoma. These are all things that I have helped my patients get better from. When we give the body enough help, going back to those first principles, we support the health. Sometimes we can see quite impressive results on things that you would not anticipate. But always keeping in mind that humility that we're not doing it, the body is doing it. So, harking back to the effects of the stress response. With osteopathic manipulation, we can directly impact the physiology of the sympathetic nervous system by treating the periphery, the afferent nerves. And I will tell you, I find a lot of sympathetic tone, for example, in hands and forearms. We can treat by treating the sympathetic chain up and down the spine. And we can treat the sympathetic tone by working with the brainstem and the fourth ventricle in cranial work. So I've learned over the years, particularly when I treat children, to always warn parents. They might sleep a lot more. I used to get these phone calls. Oh my God, she just took a 4-hour nap. Is that normal? That's with a baby. Or my 11-year-old just slept 11 hours last night. Is that okay? When you release the sympathetic tone out of these kids and that self-healing takes over, then at least for a little while, they often sleep better. And sometimes, particularly in those younger kids, that's a long-term change. I have a few adult patients who schedule their appointments knowing that they're going to want a nap afterwards. Releasing that sympathetic tone makes them tired. And I have some chronic insomniacs who tell me they sleep better for several days after they see me. So let me give you another example of this structure-function relationship, one that's a little bit broader. We're going to go back to the Spanish flu epidemic of 1918. Now, the AOA did a survey in 1920 asking osteopaths around the country how many patients they saw with the Spanish flu and how many died. Now, there were almost certainly some sampling problems. It's not randomized the way we do it today, but that's the data that exists. And that data showed that if you were treated by a DO versus an MD, the mortality rate was 20 to 40 times lower. And here's a reference for that data. Now, some of that was because, remember, this was before the advent of penicillin. There were no antimicrobials. And some of it was probably iatrogenic. The MDs were doing more harm than good at times. They had aspirin for fever. So if a little aspirin was good, a lot must be better, right? Some patients were getting up to 4 grams a day of aspirin. And for cough, they used opioids for cough suppressants. So here's an ad I found from Bayer. How do you treat the Spanish flu? High doses of aspirin and heroin for the cough. So let's think about that number, 20 to 40 times lower mortality. That's a lot. So think about that. That's a really big number. And even if there were sampling problems, there probably was still a fairly significant mortality benefit from getting osteopathic treatment. So let's look at how osteopathic care can enhance those self-healing mechanisms to give that kind of survival advantage in this population. I'm going to specifically look at the diaphragm and the intercostal muscles. Let's start by reviewing the mechanics of respiration. As the diaphragm descends, the thoracic cage volume gets bigger. As the intercostal muscles lift the ribs into our pump handle and bucket handle positions, the thoracic cage gets bigger still. And as the thoracic cage expands, the volume goes up, the pressure inside goes down. That's the ideal gas law. Volume up, pressure down. So we get a lower pressure or a relative vacuum, and the air is sucked into the lungs. When you treat the diaphragm and the intercostals and allow them to move more freely, the thoracic cage can expand more than it did before. So the patient can pull more air in. They can pull air down into those lower lobes where atelectasis and anaerobic bacteria like to sit and reproduce, aerating them instead. You create a bigger volume of air in the lungs, which means you can generate a stronger cough to clear your secretions. You'll get better oxygenation with that higher volume, extending to tissues all the way through the body, getting better nutrition and oxygen for self-healing. And when the thoracic cage expands, it's not just negative pressure pulling air into the lungs, it's negative pressure throughout the entire cage inside, pulling fluid back from the periphery. So we get better venous return and better lymphatic drainage. So now all the tissues of the body have better oxygenation on the one hand, and also better waste clearance through the venous return and the lymph, and all of the immune functions in the lymphatic system are working better too. So we've enabled the body to do a better job in its own self-healing. Now it turns out that's not just true for the Spanish flu. The MOPSI study in this paper from 2016 looked at pneumonia in the elderly, comparing usual care, so the antibiotics we give in every hospital for pneumonia, with an addition of osteopathic manipulation. And they found statistically significant differences. In a younger population where you really don't have much mortality, there was a statistically significant shorter hospital stay. In the people over 75, where there was some in-hospital mortality, there was a statistically significant drop in in-hospital mortality from the addition of OMM. So osteopathic manipulation could be added to any kind of treatment to help support and boost the body's own health, self-healing capability. Which brings us to our fourth principle, that rational treatment takes the first three principles into account. It's not limited to them. We still do everything else we want to do in medicine, but when we factor in these principles, we can give the body more support, more treatment, and more health. The story from the Spanish flu epidemic gives us an example of what that might mean. And the MOPSI study shows us how it could work in practice. As we've all heard, to find health should be the object of the doctor. Anyone can find disease. Using everything we know about allopathic medicine gives us one view of the world. Using our osteopathic lenses gives us a different view. And those two views together give us a much more complete picture of the human body, of health, of the right questions to ask, and what better answers might be. And going back to our continuum, when we get more towards that green and blue end, people who are already healthy, this is an area where we can give more health because there's no disease there to find. So what does this actually look like? Well, let me show you with a quick case study. And I like this partly because it illustrates these principles and partly just because it's a crazy story. So this is a patient, we'll call him Trent. He was a Division I lacrosse player in college. During his freshman year, he was playing much more intensely than he had in high school, double-day practices, tournaments, etc. And he noticed that as he tired, his left hand would get weak, and he would have a harder time managing his stick, his lacrosse stick. So he saw the trainers on his team. He saw the physical therapists. He consulted with sports medicine at his university. Nothing really fixed it. So over the summer, they sent him for intensive hand therapy. Now, the hand therapist he was seeing happened to be a patient of mine. And after several weeks, she said, there's something else going on here. I don't know what it is, but this is bigger than just his hand. So she referred him to me. Now, I have a 3-page intake form that I go through with my patients. I actually go through all the questions. And one of the questions is, in addition to past medical and surgical history, is I ask about trauma history. Under past injuries, he wrote that he had been bitten by a tiger. Now I'm thinking, smart-ass 20-year-old, right? When I say, what do you have to do when you're being chased by a tiger, I don't mean it literally. It's a metaphoric question. But in this case, it was actually true. When he was around kindergarten age, he was at a small private circus. A tiger got away, jumped into the crowd, picked him up by his head. He showed me the scars that he still had from the teeth and shook him the way they do. Now, clearly, he's fine, right? He's 20 years old. He's a D1 athlete. He's great. And by the time I saw him, he'd had all kinds of work done. All of the low-hanging fruit had been cleaned up. There was nothing obvious left. So I had to take a step back and start looking through all of the different lenses that I have available to me as an osteopath. Eventually, what I found was, well, the best way I can describe it is a little bit like an intraosseous strain. One of those upper thoracic vertebrae felt like the periosteum was twisted around the mineral matrix of the bone. The forces weren't lined up. It had this torque in it. And I found it by looking through the lens of those embryologic growth forces and tracing those growth forces back from the hand to the spine and the core. It was very subtle. I think what happened is it goes back to this tiger shaking him by his head. It put a little bit of a twist and strain into that bony structure, and it sat there pretty much okay until it became very stressed by his intense athletic activity. So I treated it. He felt pretty good. 2 weeks later, he was still pretty good. He left for school for the semester, and at Christmas break, I saw him again. He said he had been great all through fall training until just before Thanksgiving, it started to come back a little bit. So I treated him one more time. He was good to go. I wanted to give you that example as a case of using the tools we have in osteopathy to find health instead of just treating disease, and how we use these principles in practice even when there's no obvious disease to find. In this case, maximizing performance in somebody who's already very healthy, and how we use these principles in our thinking and our problem solving to get to the bottom of things that no one else can find. Because you're never going to be able to look up hand weakness in a lacrosse player and find check the thoracics for an old shaking injury. That's what Dave Marks meant. There was no answer in the back of the book for Trent. There is no answer in the back of the book for many of my patients. In fact, sometimes the best we can do is to find better questions. But by going back to first principles and keeping a very broad perspective, we can find a way to move forward. Whether it's someone who is unwell for reasons that no one can figure out, or in a high-level athlete who just wants to do a little bit better. And that's what I mean when I say, think like an osteopath.